Ultrasound imaging works by using high-frequency sound waves to create pictures of the inside of the body. It begins with a device called a transducer, which is placed on the skin after applying a special gel. This gel helps remove air between the probe and the skin so that sound wave can enter the body smoothly. When the transducer is activated, it sends out sound waves that are too high for the human ear to hear.
The heart of most ultrasound systems is a device called a transducer, which uses an array of piezoelectric crystals. A piezoelectric crystal vibrates when an electric signal is applied, producing high-frequency sound pressure waves, which we call ultrasound. More importantly, this type of crystal can also work in reverse. It can produce electrical signals when it detects high-frequency sound pressure waves. When a transducer directs ultrasound waves into the body, they pass right through the skin and into the internal anatomy. As the waves encounter tissues with different characteristics and densities, they produce echoes that reflect back to the piezoelectric crystal. This happens more than 1,000 times a second. Returning echoes are converted to electric signals, which a computer converts into points of brightness on the image, corresponding to the anatomic position and the strength of the reflecting echoes. A medical transducer contains a large array of crystals, which allow it to make a series of image lines that, together, form a complete image frame, called a sonogram. In addition, all the crystals are repeatedly activated many times in such a way that a complete image frame is formed around 20 times per second, so that real-time motion is displayed in the ultrasound image.
When the transducer is activated, it sends out sound waves that are too high for the human ear to hear. The returning echoes travel back to the transducer. When they are detected and sent to a computer system, the computer then processes all the echo patterns and convert them into a real-time image on the screen. As the probe moves, the image updates continuously, allowing healthcare professionals to observe structure as the heart, liver, kidneys, or even a developing fetus.
Ultrasound imaging play an important role in modern medical diagnosis and patient care. So in this presentation, we will focus on the common uses of ultrasound imaging. First of all, in obstetric, ultrasound is used to confirm pregnancy and estimate gestational age by detecting a viable fetus and determining the due date, especially in early pregnancy. It also helps monitor fetal growth and well-being by checking the heartbeat, movement, and organ development. It also used to detect pregnancy-related conditions such as multiple pregnancies, placental problem, and congenital abnormalities. In gynecology, pelvic ultrasound is used to evaluate female pelvic organ, including the uterus and ovaries, to identify conditions such as fibroid, ovarian cysts, and endometriosis. It also helps guide and support medical procedures like fertility treatment, biopsies, and IUD placement using real-time imaging. Abdominal ultrasound is used to evaluate unexplained abdominal pain or swelling by helping doctor identify the cause. It allows doctor to examine major abdominal organs such as the liver, gallbladder, pancreas, kidney, and spleen for any abnormalities. This imaging method help diagnose common abdominal conditions, including gallstone, kidney stone, and liver disease. It also used to guide medical procedure and assess blood flow using Doppler to detect blockage and support real-time procedures like biopsies and fluid drainage. For cardiac ultrasound, it is specifically used to examine the heart structure and function. It is easy to view the heart chamber, what thickness, valve condition, and measure the pump's blood in the heart. It helps diagnose heart problems like congenital defect, valve disease, and heart failure. By using Doppler, it can assess blood flow direction and speed, detecting abnormal flow or blockage. It also guides procedure in real time, such as needle biopsies or assisting during CPR to improve the safety and accuracy. Next, musculoskeletal ultrasound is used for both diagnostic and therapeutic purpose. For diagnostic purpose, it can detect swollen or torn tendon, strain or torn muscle and ligament, joint problems like inflammation or cartilage damage. It can also identify brucitis and soft tissue lumps, including tumors, cysts, or bruises. On the therapeutic side, it helps doctor perform procedure more accurately, such as injection, fluid aspiration, and biopsies by allowing doctor to see the targeted area in real time. Lastly, vascular ultrasound is commonly used to check blood flow in arteries and veins. Doctor can observe and measure blood movement and velocity by using Doppler ultrasound to see which direction the blood is flowing. It can detect blood clot such as deep vein thrombosis, particularly in the leg, which help prevent serious complications. This can also help find narrow or blocked arteries, which can detect aneurysm, area where the vessel wall builds or weakens.
Advantages of ultrasound imaging, sonography. There are 7 advantages of ultrasound imaging. Firstly, ultrasound imaging, also known as sonography, is one of the safest and most widely used medical imaging techniques. It uses high-frequency sound wave instead of radiation, which makes it safe for all patients, including pregnant women and developing babies. Because there is no harmful radiation, ultrasound can be performed repeatedly without causing long-term effects. Ultrasound is also non-invasive and painless. The procedure only involves placing a small probe on the skin with a layer of gel, so patients feel minimal discomfort. This makes it suitable for quick checkup and emergency situations. One of the biggest advantages of ultrasound is that it provides real-time image. This allows doctors to observe movement inside the body, such as the baby's heartbeat, organ motion, or even blood flowing through blood vessels. With Doppler ultrasound, doctors can assess blood flow speed and direction, which helps detect blockage or circulation problems. Ultrasound machines are also portable and affordable compared to MRI or CT scans. They can be used almost anywhere, in clinics, hospitals, and even in rural or remote areas. This improves access to medical diagnosis for many people. In addition, ultrasound is excellent for viewing soft tissues such as the liver, kidneys, uterus, ovaries, muscles, and thyroid. It also helps guide procedures like biopsies or injections by showing the exact location of organs and tissues. Lastly, it provides quick results. The image appear immediately on the screen, allowing doctors to make fast and accurate diagnosis. This is especially useful in emergency situations where rapid decision-making is critical for patient care. Overall, sonography is a safe, versatile, cost-effective and reliable imaging method that plays a very important role in modern healthcare.
Next, we are going to see the disadvantages of ultrasound imaging, specifically sonography. Firstly, it has limited image quality and operator dependent. Ultrasound has lower image resolution compared to CT or MRI, and because of this, small lesions or fine details, particularly in deep organs, may not be clearly seen. In addition, ultrasound is highly operator dependent. This means the quality and accuracy of the image depend on the skill, experience, and technique of the sonographer. Incorrect probe placement or setting may lead to missed findings or misdiagnosis. Secondly, it has difficulty imaging through bone and air. Ultrasound wave cannot travel well through bone or air. As a result, ultrasound is not suitable for imaging the lungs because of airfield, the adult brain because of blocked by the skull, and areas behind bowel gas. Furthermore, it has difficulty detecting certain pathologies. Ultrasound is less sensitive for detecting certain diseases, including early-stage cancers, small calcification, gas-related abnormalities. Because of this limitation, ultrasound often cannot provide a definitive diagnosis on its own. Ultrasound imaging also has limited field of view. Ultrasound provides only a small, localized view of the body at one time. Unlike CT or MRI, it cannot easily show large anatomical areas in a single scan. This limitation makes it difficult to assess widespread disease or multiple injuries, such as in trauma cases. More of disadvantages of ultrasound imaging is artifacts. Ultrasound image can be affected by artifacts such as acoustic shadowing and reverberation. Artifacts can either mimic pathology or hide real abnormalities, which may lead to a diagnostic error. Lastly, it has limited tissue characterization. Ultrasound has limited ability to differentiate tissue types. It is often difficult to clearly distinguish between benign and malignant tumors compared to MRI or CT scan. This limitation means that ultrasound findings are sometimes inconclusive and require further investigation. There is a clinical case involving a woman with dense breast tissue and a small breast lump. The limitation shows that ultrasound cannot clearly differentiate between benign and malignant lesions. The findings are indeterminate, and these need additional tests such as mammography and biopsy to confirm the diagnosis. This is why ultrasound should often be used as screening or initial tool, not sole of the diagnostic method.
Now I will explain the different types of ultrasound used in medical diagnosis. Ultrasound technology may look similar, but each type has different function and clinical purpose. First, we have 2D ultrasound. This is the most basic and commonly used type of ultrasound. It produces black and white image that allow doctor to view the basic structures of organ. Ultrasound is usually performed as first examination because it gives a general overview of the patient's condition. If any abnormality is suspected, doctors may proceed with the more advanced ultrasound techniques. Next is 3D ultrasound. Unlike 2D ultrasound, this type produces three-dimensional image. It allows doctors to see surface details more clearly, which is especially useful in obstetrics. For example, it helps doctors observe the shape and structures of the fetus more accurately compared to 2D images. Moving on to 4D ultrasound. 4D ultrasound is similar to 3D ultrasound, but it includes real-time movement. Doctors can observe fetal movement such as hand, this means or facial movement during pregnancy. It is helpful in monitoring fetal development and assessing overall well-being. Next, we have Doppler ultrasound. This type focuses on blood flow rather than organ structure. Doppler ultrasound helps doctor measure the speed and direction of blood flow in blood vessels and heart. It is important for detecting circulation problems, blockage, or any abnormalities in blood flows. Next is transvaginal ultrasound. This type uses an internal probe inserted through the vagina. Because the probe is closer to the pelvic organs, it provides clearer and more detailed image. It is commonly used to examine the uterus, ovaries, and early stage of pregnancy. Lastly, we have transrectal ultrasound. This ultrasound uses an internal probe inserted to the rectum. It is mainly used in male patients to examine the prostate glands. This method allows doctors to obtain clearer image that may not be visible using external ultrasound. In conclusion, although all these techniques use the same ultrasound technology, each type serves a different diagnosis purpose. The choice of ultrasound depends on the patient's condition and the area being examined.
Now I want to explain about differences between ultrasound, CT and MRI. Firstly, ultrasound imaging uses high-frequency sound waves to produce image of the inside of the body. It is commonly used to observe soft tissues and real-time movements, such as in infants and the heart. In addition, ultrasound is safe because it does not involve radiation, and it is relatively cheap and portable. However, its image quality is limited when sound waves are blocked by bond or air, which can reduce clarity. This is an ultrasound method. Next, CT scan imaging uses X-rays, which involve ionizing radiation to create detailed cross-sectional image. It is very effective for examining bones, lungs, and internal bleeding. Moreover, CT scans are fast, making them highly suitable for emergency situations. Nevertheless, this technique exposes patients to radiation and may involve contrast agents that carry certain health risks. This video for CT scan method. Finally, MRI uses strong magnetic fields and radio frequency waves without using radiation. It provides the highest image quality for soft tissues and offers greater detail than CT scans, especially for the brain, muscles, and ligaments. However, MRI is more expensive and requires a longer scanning time. In addition, it is not suitable for patients with metal objects or certain implants due to safety concerns. And this is video for MRI method.